Hi. My case this week was to discuss prednisone and alendronate, to discuss their clinical uses, mechanism of action, adverse effects, and drug-to-drug interactions. I'll start with prednisone. Prednisone is a glucocorticoid, and it acts just like any other glucocorticoid. Its therapeutic uses include in cases of adrenal insufficiency, or in cases where the adrenal cortex, the adrenal gland has been taken away, or the pituitary has been removed for whatever reason. It'll supplement the glucocorticoid production. Okay, so prednisone is given in those cases. It can also act as a feedback inhibition. So if the prednisone is given in small doses, it can tell the pituitary or the adrenal cortex that there's no need to produce as much. So negative feedback, negative inhibition. It's also used therapeutically in hematological diseases like aplastic anemia, in several neoplasms, and in musculoskeletal and connective tissue diseases like arthritis and lupus. Its mechanism of action, it acts just like any other glucocorticoid. It diffuses through the membrane because it's lipid soluble and can act directly on the nucleus and affect transcription translation. On its way to the nucleus, it binds with a glucocorticoid receptor heat shock protein complex in the cytoplasm, and then makes its way to the nucleus, where it binds to DNA response elements, in this case glucocorticoid response elements on the DNA, causing a change, regulating transcription or translation of proteins. Okay. Adverse effects is mainly adrenal suppression. Basically, if you stop the drug abruptly, it can it takes a while for the adrenal cortex to wake up to start making more glucocorticoid. So it becomes lazy after several weeks of basically you doing the work for it, giving artificial glucocorticoid. So if you stop it suddenly, in the case of Mrs. Massey, her drug is her prednisone has expired, so that's just the same as stopping the drug abruptly. And so it can cause certain symptoms because all of a sudden you have no glucocorticoid. So it can cause nausea, vomiting, weight loss, circulatory collapse, which might be applicable in her case, lethargy, and renal failure. You can also get iatrogenic Cushing syndrome from giving too much, from high doses of glucocorticoids like prednisone. So you'll get the moon face, or the puffiness of the face, and you can get buffalo hump, which is the fat in your body is redistributed, one of the functions of glucocorticoid, and you can have other symptoms like acne and stria. Other effects I listed in the paper. I won't spend too much time going through it because they're listed already, but it can cause things like ecchymosis, can cause weight gain, mood changes, diabetes mellitus in high-risk patients, several other self-explanatory symptoms. Drug-to-drug interaction, prednisone can actually interfere with other drugs as well as other drugs interfering with its metabolism. So ethacrinic acid, if it's administered with prednisone, can increase the efflux of potassium, and the risk of gastric hemorrhage in patients can increase. Prednisone also decreases the metabolism of cyclosporin when given with the chemotherapeutic drug cyclosporin. So it can cause cyclosporin, because it decreases the metabolism of cyclosporin, it can cause cyclosporin to effects to be prolonged. And estrogen, in contrast, decreases the metabolism of prednisone, so it can cause prednisone effects to be more over and beyond what it should be. Prednisone also increases salicylate excretion and enhances gastric effects. Certain barbiturates and other drugs like rifampin, phenytoin can increase the metabolism of prednisone because they inhibit the CYP450 system in the liver. I'll move on to alendronate. Alendronate belongs to a class of drugs that known as biphosphonates. Another drug that belongs to the same group is pamidronate. And these drugs generally used as the drug of choice to treat hypercalcemia and other diseases of the bone. So other uses of them, they treat another bone disease called Paget's disease, I found, and also treats osteoporosis, therefore reducing the risk of fractures, okay, because it increases bone density by increasing the calcium. The mechanism of action, it inhibits, alendronate inhibits certain enzymes in the mevalonate pathway, and in the paper I included a quick diagram of the pathway, of the mevalonate pathway. I won't go into that. But these enzymes are important for osteoclast function and survival. So basically what it does, it causes osteoclasts to go into apoptosis. And leads to, of course, the osteoclasts can't do their normal function. Okay, so it inhibits osteoclastic activity. The adverse effects of them, actually, in my research I was finding out they actually have very low side effects, very mild side effects. One of the things that can cause are like flu-like symptoms, mainly due to the body's response, immune response to them, especially when given via IV. Your body can produce certain cytokines that cause you to have flu-like symptoms. Also, paradoxically, it can cause osteonecrosis, so you use it to treat bone problems, and it can cause bone problems if not used right. So it can cause osteonecrosis, and it can cause hypocalcemia, especially of the jaw in one case that I found. They can also cause GI irritation. Contraindications, they contraindicate in people that are hypocalcemic, and people with GERD and other GI problems and renal impairment. In terms of the drug-to-drug interactions, I found that it's not advised to give them with NSAIDs like ibuprofen, or even 5-HT, basically autocoids like sumatriptan, which is a 5-HT prototype. It's because they can increase GI complications like GERD or gastritis. Okay, that's it.